Ladies and gentlemen, a pleasure being with you today. My name is Edgar Mocano. I'm the current IFFS president. We have invited you to attend an IFFS More Joy webinar. This is a webinar dedicated to the More Joy ambassadors, but also to any audience that wants to learn how to drive policy change. I'm grateful to our speakers, and I will introduce them at the end of my short introduction. Brian, next slide, please. You might have observed this QR code on the introductory slide. We are now carrying on a worldwide survey to understand a little bit more the reasons why men and women maybe decide not to have children or not to have as many children as they used in the past. So please feel free to take another picture of this QR code, but also you'll find this questionnaire on the IFFS website at iffsreproduction.org. Of course, if you fill in the survey, we will enter you into a competition to win an iPad, and the winner will be announced at our Tokyo Congress, April 2025 in Tokyo. Next slide, please, Brian. Why are we all here? The More Joy campaign is working towards making fertility care more affordable, more accessible, and equitable to all men and women. To do that, we need a policy change. And we need to talk to our politicians, we need to talk to our industry, we need to talk to anybody that can effect policy change. And today we will provide the tools you need to drive how to approach policy change. Next slide, please. The More Joy campaign was launched in January 2024, so more than 13 months ago. And we have specifically dedicated a long time to prepare materials for our More Joy ambassadors and for anybody that wants to engage with our campaign. You will see, if you peruse the More Joy campaign website, 3 specific posters. They are all targeting the 3 audiences: practitioners, policymakers, and industry employers. So this one, for example, is for the policy makers, where we ask them to understand that families grow healthy economies, that we need to change a little bit, and we're asking them specific and targeted calls to action. Next slide, please. We have translated these materials, all 3 posters, in actually 16 languages to date. And it is as simple as 1, 2, 3, where you go on the website, go underneath every of the 3 posters, and you identify the language pertinent to your country, and you can download this. This is free material for anybody that wants to use. For the ambassadors, we create this type of activities, but we also support them with anything else they need. And that's what we'll be discussing today. Next slide, please. So without further ado, I would like to introduce our 3 speakers, and also the president-elect of the IFFS, Marcus Horton, who will introduce them to you, but also will share the questions and answers. The first speaker is Professor Bart Fauser. He stems from Netherlands, and he will be talking to you on a new fertility policy toolkit that can help you work. Bart is also the IFFS Scientific Director. Ms. Anita Fincham is the representative from Fertility Europe. I don't think Fertility Europe needs introduction. They are flying the flag of patients across Europe, and they have been amazingly successful, and we're delighted to say that we have been working with them closely, as we understand that unless you support every continent and the efforts of our patient advocates on every continent, there's no way we can succeed together. She will talk to us about how to drive policy change on infertility. Last but not least is Professor Basil Tarlatzis from Greece. He's a past president of the IFFS and of ESHRE, and he will talk about how Greece came to underwrite, to support, to pay for IVF in Greece. So I'm truly grateful for all of them taking time to be here with you. And without further ado, I'd like to invite Professor Fauser to commence. Thank you.
Thank you very much, Edgar. My name is Bart Fauser. As mentioned, I am currently the scientific director and I will give you some overall scope, broad scope background information about human fertility at a crossroad. We live in exciting times with many urgent problems we have to deal with, and therefore maybe issues not so very urgent, like changes in human fertility behavior, may get lower on the priority list. And I will try to explain to you why that's not a good idea and what can be done. Next slide, please. My disclosures, none of them really relevant for the current presentation, except for the fact that I'm the scientific director of IFFS. Next slide. If you're interested in more detailed information, there are actually two most relevant publications that I can refer to you. And this is an IFFS consensus statement published in Human Reproduction Update last year with many of the global opinion leaders involved in this effort, including other bodies like politicians, journalists, but certainly also fertility patient organizations. And the focus of this particular paper was family building strategies, having children either without or with medical intervention. It's really important next to issues like family-friendly policies and the need for improved access to care globally. Next slide. An additional publication is actually coming next month in RBMO, Human Fertility at the Crossroads, which we will push this concept even further. That it's really vital that we take actions and provide background information, why this is needed and what can be done. Next slide. Although it is a very sensitive issue to discuss with a lot of arguments back and forth, certainly also in the lay press, slowly politicians at a government level or at a European Union level. This is, for instance, I think a very relevant report released October 2023. This is actually, you can just download it via the internet. Demographic changes in Europe. And why is this relevant? Population continues to decline. There's more and more aging population and less youngsters. Negative impact on our global competitiveness, labor shortage, and not so lateral. That is social cohesion and even influence on migration. Next slide. So they propose several strategies, either focusing on the parents to make it easier for them to have children, on youngsters in improving their growth capacity for later life, elderly people, and of course here healthy aging and self-support is very important, and also whether you like it or not. Changes in fertility and offspring certainly also have implications for migration. Next slide. Another report where I was involved in released just a couple of months ago, and again, freely available on the internet. So if you just check economic impact, economist impact and fertility policy, you can download the PDF. I think a very useful piece of work where they try to summarize what has been done and what are the impacts, and then what can be done. Of course, there are several factors you can influence, and it tries to be fairly specific in giving tools for government bodies and policymakers to say, if you change this button, if you do something here, this may be the implications. Next slide. First, and I'm not aware that this is anywhere else available in the literature, it scanned all the literature on, let's say, family-friendly policies. For instance, childcare policies. There are more and more governments that reduce fees for childcare. and in some countries make it freely available, and it details the publications in various countries and more at the European level, what the implications are for childcare policies, workplace policies, for instance, in extended parental leave. What does it mean? Has it been measured? In some cases, it has. So when a measure was undertaken by the government that they monitored 1 year later, 2 years later, are there implications for the number of children being born? But I think the brief summary of all this detailed information is it's usually poorly studied, it's usually only looked at long-term effects, and the measures taken vary greatly from country to country. So there's very little, if any, international or global coordination. Next slide. So it's also looked at financially. What does it mean if you either have fertility care covered by health insurance companies? What does it mean? For instance, this is a calculation. If you look at the bottom line in the UK, if ART access would increase threefold, because we know in the UK there's long waiting lists, what does it mean in terms of total fertility rate? Here in Canada, in 2019, there in a certain province in Quebec, they started to cover ART. What does it mean? What are the effect of such measures? Again, it varies a lot from country to country. It's usually poorly studied, and there's no international coordination. Next slide. So this is a busy slide, so don't bother about the details, but I just want you to understand so that they developed a toolkit, which I think is very practical, and it's the first of its kind, as I can see it. Let's say, if you influence a certain measure, what are the implications? And here you see them again: childcare policies, workplace policies, financial policies, assisted reproduction policies. So all measures that you can undertake to stimulate or make it easier for people to have children who want to do so. And then you can see what are the implications in terms of fertility, in terms of money, and in terms of society and individual impact. And of course, this is not all rocket science, but I think still this is the best evidence available today. Next slide, Brian, and I guess this is my last slide. So very overall, this is their executive summary. So prioritize long-term thinking. It does not exist in the context of fertility. It's all haphazard and all short time. Invest in comprehensive, complementary, and sustainable family support services. Again, this is not present at all. Encourage research and collaboration. There's usually strong opinions, but there's very little data. And promote and encourage gender equality. That's, of course, a very broad concept, but very, very relevant in terms of having children, still, which is often seen as a matter that concerns women, especially, but in terms of gender equality, that could and should change in the future. Thank you very much for listening so far, and I'll give the floor back to the chair, Marcos.
Thank you, Bart. Wonderful presentation. We'll have discussion after the talks. And please, my pleasure to introduce Anita. As Edgar mentioned, she is a Galaxy Manager for Fertility Europe and mother of 2 IVF babies.
Hello, thank you very much. Thank you for inviting Fertility Europe. Thank you for inviting me. And yes, the babies are, one is well in the 20s and the other is teenager. But yeah, somehow we still in the same field, and we all in Fertility Europe have the experience of infertility. And it makes me think we are all in the world here with you as well, with the medical specialists dealing with infertility. We are the part of the world that actually wants children. And we have to remember that this is our lens when we address the issue. Next slide, please. So why we think that fertility treatment access matters? We know that WHO assesses that it's 1 in 6 people worldwide face infertility. We know that this is only concerns the couples. So we know there is more people that face involuntary childlessness, people, single women, same-sex couples, and we know definitely that there is a thing called fertility gap, which means that people in their early youth declare that they want to have 2 children or 3 children, and they end up having, for whatever reason, for many reasons presumably, they end up having 1 or maybe none. And medically assisted reproduction can provide support for this issue, but the access varies in Europe, even in Europe, not to mention the rest of the world. And it's very unequal and it's very uneven. So our goal, our advocacy goal, is to ensure equal access to safe and efficient fertility care. Next slide, please. So how do we go around this issue? What do? We try to, the best advocacy tools are data and information. So what we often do is patient surveys. So we can tell the policymakers, look, this is what patients think, that's what people need, this is what they express. Patients' testimonials, so they can talk about their experience, about their needs, about their emotions. That can produce both the data and the emotional reaction as well. And reports based on the data we collect, based on the surveys we collect, based on the data that we get from the medical scientific organizations, we produce the reports, which we can show to the policymakers. And another wonderful advocacy tool is cooperation. So working with, obviously, politicians, but working with other organizations. So we can meet with them, we can exchange the best practice, we can participate in their events, invite them to our events. We can signing and supporting their statements, their manifestos, invite them to sharing their materials, inviting them to share our materials. But also, it's very important that we listen to them. We learn to speak their language. We use the expressions that they use to properly incorporate their priorities in our work and encourage them to understand our priorities so they can translate it in a way that they can use it in their work. And again, it's work, because we need to take care to listen to their whatever they produce, whatever they do. We need to read their reports, respond to their surveys, share their events on social media, read and sign their manifestos, and ask their views and understand that their outlook may be different. We maybe listen to their worries. Yeah, for example, like I said, we live in the world where people want to have children. As we know, that situation is, we need to listen that they worry that we may be too pronatalistic, which may lead to the sort of affecting the restricting reproductive rights, which some countries attempt to do by, restricting access to, I don't know, contraception, abortion. That should also be considered. So we work on the sort of rights-based scenarios, and we make sure that we want access to treatment and we want to support people who want to have children. And that needs to be said, that needs to be listened. The same with the politicians. You have to learn to speak the language and provide them with what they need. Next slide, please. They slightly overlap. So with the politicians, we work with, and don't get me wrong, we are still learning and learning all the time, and we like to be supported by the in their advocacy work. We like to be supported by the Brussels Communication Agency, because European Union can be a maze for people who are not specialists, because you can talk to members of the European Parliament, you can talk to European Commission, you can talk to the Council of the European Union, councillors, attachés. There are also national politicians that get involved in the work of the European Union. And the competences are very complicated, they're very mixed, they overlap and intertwine. So the important thing is that you need to be able to answer the question when you talk to the politicians. When they ask you what we can do for you, you need to be able to be prepared to have the clear message for them. Now, this message obviously has to be crafted by you and well prepared and well explained. But then that's why it's useful to have the help of the agency, communication agency, which may help you set this task into the context of the works of that's happening in the European Union. So the policies that being worked on at the moment, or the new laws that are being created. So this is and to the competences of the politicians that you're addressing, to find out what are the manifestos of each party. And that's complicated. We're still learning, but happy to share what we know. In terms of the other organizations, again, it's the outreach that matters. So like I said before, we're talking to our member organizations to find out what their priorities are in Fertility Europe in various countries. We talk to medical associations. They are our biggest supporters, and we work with ESHRE from the word go of Fertility Europe. We're very happy to have cooperation with IFFS, because this is what our joint effort is, to be able to provide this message that there are people who are involuntary childless and they need support, and we understand what we're talking about because this is our everyday life. But then again, there are other organizations that deal with other patients' rights, with sexual and reproductive health rights, women rights, women health, mental health. So this is where we can find the overlap, and like I said, by working together but taking on each other's priorities and issues, we can be stronger when talking to policymakers. Next slide, please. And these are a few examples of our work. So this is data. Yes, the data for the European Atlas of Fertility Treatment Policies come from ESHRE survey, but we enriched it with our own data on from the patient survey that we created. We selected criteria from the very, very big survey that are, in our opinion, most important for the way that the patient can access treatment in each of the countries. We define the model country, and we find that this as a picture, as a advocacy tool, is very useful. We have seen a lot of results, a lot of changes that were created in Europe with the help of this tool. So important thing is also, again, here, cooperation. Yeah, we do it together with European Parliamentary Forum for Sexual and Reproductive Rights, because they have created this Atlas tool. The data comes from ESHRE, and then we just find that it's being very eagerly shared by the press, by the politicians, by the scientific presenters as well. Next slide, please. And then starting from the other end, what you do to actually be able to avoid having fertility treatment. So education of the young people. Again, we've collected data from 4 pilot countries. What teenagers know about fertility. We gave them some more information about what needs to be, what they should know, and we created this report, which will be presented later this month in the European Parliament, about telling the politicians how what young people know about fertility, what they should know to be properly prepared for life. And again, there will be two sides. There will be scientific paper created from this data, but also advocacy report. Next slide, please. We've been working for ages. We have this European Fertility Week since 2016, where each year we tackle different issues. And again, this is to show from the social media, to educate the public, to educate the politicians. On the back of it, we create the call to actions. We create the testimonials, reports, and also toolkits for our partners and for our members, so they can be every material can be adjusted in the national language, can be adjusted to the needs of the national organization or again our partners. So both outreach, both data and information. And I think we are coming to the last slide. The Coalition for Fertility, something's missing here, but this is our most recent project on advocacy together. If you have a look, there's 12 organizations that work together to advocate for better access to fertility and understanding why fertility matters, why there is fertility gap, and create this stronger advocacy push for better rights. And I'm very pleased to see that IFFS is among the signatories, and I'm happy to tell you more about this work when we have more time. Next slide, please. And just wanted to say the More Joy campaign, if you have a look what I marked here, it addresses health professionals, what to do. It addresses policymakers and companies. These are very important players in this field, and very interesting to see how this campaign is developing. And thank you very much. Next slide, please. Thank you.
Thank you, Anita. Thank you for your presentation. And now we move to Dr. Basil Tarlatzis. Basil, welcome.
Thank you very much, Marcos. Great pleasure to be with all of you and discuss this important topic about the global fertility rates declining and the special case of Greece that I will mention. Next slide, please. These are my disclosures, but none is related to this topic. Next, please. One of the issues that we have to take into account when we discuss the declining fertility rates is also another component is the fact that in the last years, as you can see by focusing on the green bars, that increasingly women opt to have their first child well above 30 years of age, whereas it was much lower in previous years. And as women's age increase, then fertility also decreases. Next slide, please. Next, please. Oh, one back, please. No, back. Yes, next. Okay, so we see here the total fertility rates declining globally in all parts of the world. Next, please. Next slide, please. Now, if we come to Greece, next, move on, please. Yes. In Greece, the total fertility rate in 2015 was 1.33. In 2022, the same. but in 2023, it dropped even further to 1.26. Next, please. Conversely, we can see here the births and the deaths, and as you can see, in between 1955 and 59, there were more births than deaths, almost 100,000. But if you go down at 2022, the births were 82,000 and the deaths 138,000, which means a deficit of 56,000 people, which is a very significant decline in the population of Greece. Next, please. And on top of that, we have the longer survival rate, longer life expectancy, as we can see in all parts of the world, going up. Next, please. Which affects this pyramid, the age pyramid in Greece in that case. So we can see here that the, next please. Yeah, we see here that the age above 65 years, it was 8.2% in 1961, and then 16.3 in 1997. Next, please. Whereas the current numbers show that the people with age over 65 years now increased from 16 to 21.3%. Population average is 46.5 years. And next, please. And population over 80 years, it's 7.1. Next, please. This has very important ramifications because the number of people in the country, the population is decreasing, and there is already a shortage of working hands, both for the farms, for the hotel industry, and so on. So this is an important issue. Now we come to ART, IVF, and next slide, please. So it has been found that in China, for example, in 2017, there were 17 to 18 million babies born in total, from which 100 to 200,000 were from IVF. Thus, 0.6 to 1.1 of the babies were from IVF. Next, please. In Denmark, conversely, 10% of all babies born per year are from IVF. Next, please. And also in China, it is estimated that in 2030, 2 million IVF babies will be born per year. Next, please. In Greece, we did the same calculation, and in 2011, the percent of babies born from IVF was 3.4, whereas in 2018, this increased to 5.8. Next slide, please. So in Greece, the warning bells rang last year, and the government started to see what can be done. Greece is the first EU member state to develop a national plan of action to face the demographic challenges. It is a 10-year plan with a budget of 20 billion euros from the EU Recovery Fund, and includes 100 focused actions, including housing for young couples, which will take 2 additional billion euros, new kindergartens and nurseries for taking care for the little babies, support for the working mother or father, new jobs, financial support for more children per family, and recently the government announced that they are considering financing in vitro fertilization and ART techniques in order to support this activity, and also to provide without cost, free of charge, to provide AMH so that women can monitor their fertility and adjust their life accordingly. Next, please. So we can conclude based on whatever I showed you. Next, please. That next one and next one. So we can say that ART definitely is not a solution for the demographic problem, but undoubtedly contributes to the increase of children born. Focused state policies can address the demographic challenges, but it takes a long time to correct. And it is very important to inform the public and raise awareness about the demographic problems, because that that needs to be addressed, because now people don't realize the medium and long-term ramifications of the declining number of people in the different countries. So it is important to inform and raise awareness in order to be able to make solutions that will be well perceived from the public, but also will be efficient in reducing the problem and promoting more children for our societies. Next, please. I would like to also to reiterate the IFFS campaign for more joy and more children, and to thank you all for your attention.
Thank you, Basil. Well, I mentioned to the audience that we are very receptive to your questions. If you have any, you can post them in the chat box. I would have one question for Anita. As you mentioned, you have experience with dealing with politicians, and I think Basil and Bart too. So you mentioned we have to be strategic in how we approach politicians, and you mentioned give them what they need. So what would be a good tip? What would a politician need from us, or in what way would be your tip to approach politicians? I understand this can be different in other parts of the world, but please give us your experience.
Well, thank you very much. The thing to remember with the politician is that on the European level, what are the competencies of the European Union and what are the national competencies or member states' competencies? So when we talk to the European politician, we can talk in a way that they encourage them to give guidance to the countries. I mean, we can appeal to the equality always. Equality is one of the competencies of European Union. However, the details of health policies, this is the national competence, and they say, this is not what we can deal with. Yeah, but we can talk to them about including the right to fertility treatment into the guidelines on sexual and reproductive rights, for example. We can talk about the equal access to treatment, all the treatments, like the patient's access, yeah? So that to show that the infertility patients are the patients, that the fertility treatment is not the lifestyle choice, which was treated like. So this is the issue, and then obviously talking to the national politicians and show them the benefits of all those issues. Thank you.
Thank you, Anita. Bart has a comment, and Basil too.
Yeah, I'm not sure if there are other questions from the audience, but I too have a question for Anita. I watched your recent performance at the EU Commission discussion. That was very positive. But for me, I encountered quite some negative attention, particularly in the news media, the newspapers and journalists. Quite some aggression to talk about fertility. people have the idea and say, women, there are more and more women that do not have children, and they may feel discriminated by your focus on having children. So it should be a free choice. And so how do you respond to that? Because I presume that you have had that criticism also. Can I learn from you how to deal with that?
Like I said earlier, we need to listen. Yeah. So we are our lens. Your medical specialist dealing with people that want to have children. I've been in the infertility patient associations for so long that most of my friends are infertility patients. Most of the people have spent years trying to conceive, and they can see nothing more important than having children. However, there is a growing group of people who choose not to have children. They may change their mind or not. Their reasons are diverse. And also, it's important to listen that being put in a situation where you are in unwanted pregnancy, or when you cannot safely avoid pregnancy, due to lack of access to contraception, or when you're in a situation where you don't even feel like you can think of having children because of economic situation, because of housing situation, because of lack of security at work, or because of the wrong relationship, or lack of relationship. We need to listen, and we need to accept that the trend of sort of women being independent and being, the equality for women and the rights-based is really valid, and we need to support it. We need to make sure everywhere that we ask for including the right to support, to have children if you want them, for people who want them. And somehow it needs to be said over and over again. And I think it's important that politicians and the other organizations believe us, that we mean it, that we don't want to be that we don't want to be pronatalistic in a sense that people should have children at all costs. We just want the people who want to have children to be able to access services that support them in this decision.
Mm-hmm. Thank you.
Thank you, Anita. There is a related question from the audience. Paprin Nahar is asking, how would you strategize in a low and middle income country where poverty and overpopulation are major concerns? Maybe we have the same situation in a lot of countries in Latin America, but even in these countries, we have a decline in population. But how do you balance between the priorities, and if you have to address maternity or childcare before infertility, what would be the argument there?
Is this me again?
Yes, the question was for you, Anita. Sorry.
Well, our work focuses on Europe, Reach Europe. But if you come back to this sort of rights-based approach, then you back to understanding that the education, information, and the right of support in not having children and in having children is like two sides of the same coin. And like I say, I don't have experience working with the countries outside Europe, but this seems to be solution.
I guess we can also say that in a lot of countries, even though like countries like India that have been growing their population, even in those countries we have a decline in the fertility rate. So the rate of overpopulation is not really that but I guess this is a situation we will address in our next policy webinar with African colleagues. So there is a question also from Yavor Vladimirov from Bulgaria. If we have more details about this 20 build project, maybe it's addressed to Basil, I'm not sure.
Yes. What about it? So I would like to make a comment. I don't know what it is. What is exactly the question?
Maybe Yavor, you could repeat that one about a 20 build project.
Yes. So I think that also in relation to what Anita mentioned is that yes, the two policies should not and are not competing, and they are complementary. None of us, thinks of imposing to those who do not choose not to have children or cannot have children, to impose on them that they have to have children. No, the answer is just to inform people and to inform the public and the politicians that that this is an important issue, and provide means to support those who wish and want to get children. So this big fund, this amount of money is derived from the EU fund that was provided to countries for COVID damages. And so the government decided to spend money to support, so housing for young couples especially, nurseries and stuff for the children and the working mother or father, and also to support IVF, again, in the sense not that IVF will solve the problem, but it gives the opportunity to couples that wish to have child and cannot afford to do IVF or other procedures, to be able to do so. So again, I think that our perspective should be full understanding for those who don't wish or can have a child, but try to provide the opportunity to those who wish but cannot afford to do so, and that would be helpful for society as a whole. I think that's the bottom line idea.
Thank you, Basil. There's a question, maybe Bart, you can address this one. Ghulam Bahadur is asking, I wonder if wars and refugees disturbances impact on the European Union population changes.
In general, of course, we all follow the news, what's happening in the Russia-Ukraine war, and the number of casualties is enormous. So for sure, that will impact on children and offspring. Number one, and number two, it will of course also impact on financial situation of those countries and the possibility to improve access to infertility care. We know now, particularly in the Ukraine, of course, if peace will be accomplished in the near future, the country will be bankrupt. So there will be not much money available to improve access to care. Whereas I see in other countries, I know it's not in the literature, but I know firsthand in countries like Serbia, Georgia, Hungary, Serbia. So in all those countries, IVF is now fully reimbursed. And of course, you have seen a huge increase in the number of IVF cycles. So a huge increase in access to care. And of course, there can only be one reason for this policy change, and that is that governments start to really realize the implications of underpopulation in terms of employment, finance, taking care of the elderly. So things are rapidly changing. And of course, we all know in Japan and in China that these are big, big issues. On the other hand, we can see, access to infertility care is one, the focus of Anita and organization. But of course, the fertility gap is something else. We now know that in more and more countries, certainly in higher educated women, almost 1 out of 3 end up not having children. They cannot change their mind because this is after 45. So they will be without children. But whether this is really by choice or just pushed on by circumstances, we don't really know. There are no data to what extent this is really a positive choice or not. And there, of course, also measures can be taken to improve or to lower the barriers for these women to have children at all, or to have a second child if they wish. But there we need to understand much, much better what is going on and why we have this behavior. And you see that particularly in Japan. I think that the implications are biggest in Japan because there's zero immigration in Japan, and Japan is the country with the lowest fertility rate. And everybody realizes very clearly that within now and 10 years, this is going to have major implications, and they don't really know how to handle this.
Yeah. And if I may, just a short comment further to what Bart said. It's amazing that when 1 or 2 years ago, China found out that the population shrunk by 1.5 million, immediately there was a red alert. They immediately stopped the one-child policy and they started promoting IVF to have more babies. So again, it's my concern with politicians is that because it's not a serious impact immediately, they don't realize that, or they don't want to realize it. So they let it be there. But it is important, as you said also, Bart, in the long run. It has ramifications, very important ramifications for the country. So again, all these things need to be conveyed to people. And then, of course, people will make their own decisions. We are not going to impose things on them, but just to know that these things have serious ramifications.
Yes, and that's the importance of promoting this campaign and trying to overcome the previous narrative of the overpopulation of the world. And this, as I mentioned, it has changed all over the world. Even in low-resource countries, they are declining their fertility rates. So there is one.
Marcus,
Yes,
could I just add to this? Because I think that is very, very powerful. That big medical organizations, predominantly the World Health Organization, they, of course, have been focusing on health issues. But until recently, they completely ignored the issue of infertility because the general concern was overpopulation. And why, of course, focus on having more children when overpopulation? It's only since the last few years, and now you can see, when you look at the WHO website, there is a lot of infertility now, and there are going to be infertility guidelines released soon. But again, this is all very new, only in the last couple of years. So it tells you something about the overall the mind of people and politicians was we have to deal with overpopulation, and that prevented infertility from becoming more a higher priority.
Agree. And even though if we go further, I think the more challenging question is about voluntary childlessness, and that's a societal issue that has been really in the last maybe 10 years very important and is growing. So that's going to be challenging for all of us to address.
Yes and no, and we have to understand and we have to acknowledge that when my generation was young, it was the purpose for almost everybody to start a family. That is no longer the case, and there are more and more people that have other purposes in life and define other purposes in life, and that's of course perfectly fine. And we have to be careful not to offend. I've heard people say publicly, oh, you're saying that I'm a second-rate citizen because I'm a woman who choose not to have children. Of course, we have to listen to people, Anita, what you were saying, and we have to acknowledge that, having children is no longer the norm for everybody. On the other hand, we know the great desire for people who would like to have children and are not able to do this because of medical reasons, financial reasons, etc., etc. And I think we have to be very, very clear in making that distinction.
Thank you. Edgar?
Yes, discussion is very interesting. And while I agree with both sides, there is a significant issue that is not discussed at all. And this is the other side of the contraception. We have, for many years, 60 years, discussed contraception as the solution for the global growth. And we have not, at the same time, discussed fertility with patients. And if you practice, like all of us do, the biggest regret in patients that we see with infertility is that they have no information. They receive no information of the importance of having children when young, and also placing children part of their life plan. And I think society has failed everybody. There should be no contraception provided without also information about fertility. Our politicians need to understand, and our industry need to understand, and this is why we targeting industry, that if you just push work, 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 and you don't give people time to have children, to think about having children, then you will have no employees in the next 50 years. So these are many things that are not discussed openly. You never see an article in a paper. You never see an article on the big stage to say, hey, companies, it's not all about profit. It's also about letting people be humans and having children if they so wish. And hey, governments, why you, for example, why are you not talking to the young generation why they don't have kids? And it's pretty clear. They'll say we have no house. Okay, because property is so expensive, make property cheap. Why can't we force banks to give interest-free mortgages for people that want to have a family? Why can't we tax people that want to have a family less? Why can't we tax people that want to work all day and have no children more? These are important questions that we have not answered. And I think this is the reason why we have these meetings, where minds come together, where society will now take a stance. Thank you.
Thank you, Edgar. And there is one last question that is probably addressing what you were saying now from Ghulam Bahadur. The governments have been punitive for people with children with taxes. So what can be done here? And I guess that is related to pro-parental policies that can be implemented, as you mentioned, Edgar. And there is some good experience in some places in the world, like Singapore, that has been having pro-parental policies for more than 30 years now, and they have been renewing them because of this. Even when they had baby bonuses and packages for families, they have seen even a further decline. So they are always modifying and renewing these pro-parental policies, and the last one was a few years ago where they increased the packages for the baby bonus and the packages and the discount in taxes. So I think that's probably the best way to go. And these are the meetings where we can discuss this and we can approach politicians. Then we haven't talked much about corporations, but I think we have to focus heavily on them too, because they can be advocates for these policies. So I think we are just about the hour now. Just so very happy to say that we have had more than 50 participants. Thank you very much, everybody. We can have all your activities as you see in the IFFS blog. Anyone of the ambassadors that have experienced any meeting or any action in your country, you can put it in our IFFS blog. We will be happy to publish it in our blog in the website. As you can see, we have published news from Italy, Greece, Chile, and all over the world. So thank you very much, everybody. Thank you for the brilliant talks to speakers. Thank you, Edgar. And we'll see you in our next policy webinar for the African region in April.
Thank you.
Thank you.
Thank you very
Thank you.
much.
Bye-bye.
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 Edgar,